A viewer writes, "Hey Jim, I'm about to face a back surgery in the near future. I'm 3.5 months post transplant. Are there any concerns, any worries, any dangers involved? What should I do?" Stay tuned.
Hit the subscribe button and click the bell notification to become part of the Transplant Helper community.
Hey folks, welcome to the Transplant Helper again today. My name is Jim Merle, and today we're going to be discussing together the potential for facing certain tests, certain procedures, or possibly even surgery post-transplant. Now, you know as well as I do that post-transplant, because we're on immunosuppressant drugs, therefore our immune systems are much lower than they would be, say, in the typical person. We have to be very, very cautious whenever we're going to be exposed to anything, especially infections that could potentially get into our bodies. And that is always a danger, always something we have to watch out for, even if it's just going in for a simple blood stick, a prick, in our skin, an IV, or even up into a major surgery. Anytime our bodies are going to be opened up, there's the possibility at least that some sort of a virus or some sort of a bacteria, whatever, infection could be introduced and cause us some real problems. So with that said, basically the viewer here who wrote this question is someone who's going to be facing a surgery in the near future. I think it's kind of elective for him, although I'm not sure. But anyway, he asked for advice, and I'm going to give it not just to him, but to all of you who are watching. So there are basically three things I like to remember before I go in for any procedure, any test, or especially if I were to be facing a surgery. And that is, number one, avoid all elective procedures, okay? Just say that out of the gate, especially inside of that first year. Avoid all elective procedures. Now, I understand as an elective procedure, I'm talking about something that you can get by without, something that's not life or death, something that's not threatening your overall health. Maybe it's just something you kind of want to get patched up. I've got a good friend, for example, who's I think about a year or so post-transplant now. He's having a lot of problems with his knee, and the doctors have told him that at some point in the future, he's going to need that knee to be replaced, okay? So a knee replacement surgery, that's in the cards. That's what the stars hold for him. However, his transplant team in turn told him, because that's not something that has completely debilitated him, something that's keeping him from being able to recover, even to do light exercise, they don't think it's a good idea. They think he needs to hold off. And I can agree with that. And they tell him that because, again, he's immunosuppressed and they just don't want him being taken in for unnecessary procedures. And you could extend that out to anything. And I get, say, when it comes to a back procedure like the questioner asked here, yeah, I probably would have to really weigh things out in that, because a back pain, a problem with your neck, a back, the spine, certainly that can be very problematic, very painful, and it could take it to a level where it's debilitating you, where it just has to be done. However, I encourage everyone to always avoid elective procedures, whether it's dental work, knee surgeries, surgeries on your hands, your shoulder, whatever. If you can get by without it, at least for a time, go ahead and try to put it off. You're better off not exposing yourself to that potential for infection. You're better off just trying to live your life. Now, that's not to say we won't get it done someday. Certainly, we all want everything fixed up as nicely as it can be, but you may have to put it off for a while. So number one, avoid elective procedures. Number two, even if those procedures come up, always ask your team to be a participant in that. Now, I'm blessed at UAB Hospital, Birmingham, Alabama, which I brag on a lot. I get it. But I'm blessed over there that pretty much every specialty, everything that could possibly be done to your body can be done in-house, okay? And my transplant team has always, and I suppose will always, oversee my care as a whole. Even if it's from going to the eye doctor, to the dentist, just the minor things in life. They make all the orders, they make all the recommendations, and they participate in those things, okay? But I would encourage you, if that's not already the case with you, you need to have a sit down with your team and ask them to oversee this procedure. Say, for example, I'll use the example of someone who's going in for that knee replacement. Maybe it's gotten difficult, maybe it's time. I would sit down with my transplant team first and ask them, is it safe? And if it is safe, what can you do to help me make sure that I maintain and take all the precautions necessary to get this done right? And I think your team would definitely be willing to do that. They would definitely be able to help you make a decision whether to go for it or to wait, or whether or not it shouldn't even happen, whatever. Ask your team to be a participant. And we need to always be doing that. And it doesn't matter if it's the fact that you've got a common cold, maybe you think you have the flu, whatever. go ahead and let your team be a part of that, because your team is just what it sounds like. They are a team, and they're in this to win it with you. Okay, so ask your team to participate. Ask them to oversee it if possible. Again, my transplant center, they can do that because they're all in-house. If maybe you have to go to an outside source, they can still do that. They can get the records, they can make recommendations, and that's the way to go. So number one, avoid elective procedures. Number two, ask your team to participate and oversee. And then number three, whatever the decision is that your team helps you to make, go ahead and try to accept that, okay? And again, I'm referencing my friend who goes in, his knee's killing him, he's having problems, he wants to get things fixed, and the team says, no, let's not do that right now. It's not worth the danger. It's not worth the problems it can cause. Let's not do it now. And even though he didn't like that, even though he wasn't a fan of such, he listened to what they said, and he decided to go back to that surgeon and say, look, I talked it over with my team. They don't think it's the right time. And they even made some recommendations then of certain, rehabs and programs that could be involved in. Maybe even to an extent, to a very small extent, but diet changes he could make, things that would help that joint to be, more lubricated and to work better. And he took their advice, and lo and behold, he's not as excited about that surgery now. He's pretty much okay going along to get along, at least for the moment. And I think that's what we always need to do. Okay, so with that said, again, just to recap, avoid, ask, and accept. That's the key to this. If you're facing a surgery, a procedure, something that you question, your team is the best resource for making those decisions. I hope this has helped you out in some way. If it has, go ahead and give this video a big thumbs up. Consider sharing it out with a friend. And as always, be watching here on the screen beside me. You'll see some recommended videos popping up, maybe related to this subject, maybe about something altogether different, but I'll assure you it is a part of me wanting to do what I can to help to advocate, educate, and motivate you as a transplant patient. Thank you so much for watching. Be sure to subscribe, like this video, and share it out. But until next time, stay stronger, friends.